Well, I've been waiting for somebody to bring up this subject in the health reform debate discussion and haven't heard it yet, so here I am. This is a document by the Centers for Disease Control published in September of 1998 in which we were informed that the maternal death rate in the United States is higher, it was in 1998, than it had been in 1982. And guess what? It's even higher now in 2009. Even worse, we were told here on the second page, the actual rate could be 3 times what's reported in the vital statistics records. And that's the one that gives us our ranking in the world, which last we heard from the World Health Organization, 40 countries did better at preventing maternal deaths. That's the ones directly related to pregnancy. So we're pretty bad. At best, we're 41st, but we don't actually know what our world ranking would be. So about 12 years ago, I began working on a quilt. And I started collecting quilt pieces. I actually started making them, and I got other people to help me. So here you see one of the panels. The panels generally contain 20 different blocks, each one devoted to a woman who died. Sometimes, very rarely, her death was not preventable, and that would be about 3 women in 100,000. But most of the time, and the CDC acknowledges this, these deaths could have been prevented. Sometimes it's from C-section complications, sometimes it's from complications of induction, and sometimes we've got complications that are probably related to lifestyle, getting into care too late. Obesity can be a factor, yes. And it's not just poor women, although there are poor women here. Here's a woman who died because she didn't know that if you have a pain in your leg after you've had a cesarean, you better find out, because it could be a blood clot that could be fatal. This is the most recent block that was sent to me. This is a mom who died in July of this year following a C-section. Don't know exactly the reason, often I don't. And the bag here is, I've got another 40 or so in here. So that's 2 more panels worth. And I've got 8 more upstairs. There's one being put together in Iceland. You know, there's a lot of interest in this because the rest of the world tends to follow the obstetric policies that we do to a large extent. So when induction and C-section by choice becomes popular here, a lot of the rest of the world goes there too. Not always a good idea. This is the 2009 pieces. I've got quite a stack of them here. I'll get 2 more, or 2 or 3 more, and then I'll put this next panel of 20 together, and one of my volunteers will do the finishing work. I want to show you what happens in the UK. The 4 countries of the United Kingdom every 3 years give us a heavy book, right? You can buy it in a bookstore. It used to be called Why Mothers Die. And then we got the 3-year period. England, Wales, Scotland, and Northern Ireland all cooperate to do this. And the idea is that you first find out every single maternal death that happened, you get all of the records in, and you have an impartial group of experts look over all the records and find out if anything could have been done better. And then you feed that information back to the midwives, the nurses, and the public, and to the obstetricians, the doctors. In the United States, our equivalent would be, for this 12 years of work here, we would have 12 pieces of paper just like this one. That's how we value women's lives, mothers' lives today in the United States. We could do better. And my first idea about what we ought to do as a first step is we ought to require that every one of the 50 states uses the U.S. standard death certificate, that we fall in line with other countries in the world do. where they have an agreed upon way of gathering the data that every part of the country has to adhere to. So we need to do that.